Welcome to Module 1. Before we begin discussing coping strategies, it is important to first understand the emotional experiences that often accompany breast cancer. Many women tell us that receiving a breast cancer diagnosis changes nearly every aspect of their life, not only physically, but emotionally, socially, and mentally. Receiving news of a breast cancer diagnosis can trigger many emotions, including fear, anger, sadness, worry, grief, and more. These emotions can be difficult and they can persist throughout the treatment process and into survivorship. The first step in coping with the emotional challenges of breast cancer is to become aware of these feelings and learning how to recognize and respond to them. One of the first emotions many people experience is stress. Sometimes stress is short term, such as waiting for biopsy results or preparing for surgery. Other times, stress becomes ongoing throughout treatment, managing appointments, balancing work, caring for family, and coping with uncertainty. The main difference between acute stress and chronic stress is that acute feels less intense and is usually a quick reaction to a specific event. It'll last for a shorter time, while chronic stress is less intense. However, it continues on throughout days, weeks, months. These can be tied to things such as personal, financial, or work worries, as well as fear about the future. Situational triggers are also events that can trigger this stress response, such as making treatment decisions, experiencing symptoms and side effects, scans, and other tests to see how your cancer is responding to the treatment, as well as being asked about breast cancer. Anxiety is another very common experience of women diagnosed with breast cancer. It can be difficult to recognize as it often involves a range of emotions. It is a natural response to the uncertainty of a breast cancer diagnosis. However, its symptoms can become problematic in everyday life. You may experience symptoms such as restlessness, trouble falling or staying asleep, the inability to turn thoughts off. Then it also can manifest as physical symptoms such as sweating, chest pain, shaking, increased heart rate. Some anxiety is a completely normal response to uncertainty throughout your breast cancer journey. However, consider reaching out for help when symptoms become persistent, intense, or start to impact your daily activities, including work, sleep, or your close family relationships. You may have heard of a term called scanxiety or scan-related anxiety. This is a form of anxiety or distress that can be experienced before, during, and after cancer-related imaging or scans. It's important to understand that unlike anxiety disorders, there's no official guidelines for scanxiety. It is seen as a normal reaction to getting a scan. Still, it is considered a negative emotional response that can affect your overall quality of life, especially if you have to have these scans quite often throughout your journey and immediately after. You might experience difficult symptoms such as difficulty sleeping, lack of appetite, increased heart rate, or high blood pressure, as well as mood changes, recurring sad or anxious thoughts, and difficulty focusing. If you have experienced this, you're certainly not alone. Breast cancer can also bring about periods of sadness, grief, frustration, and feelings of depression. Depression can be described as a combination of sadness, despair, and loss of energy that can interfere with your daily life. It can cause symptoms such as continued sadness, depressed mood, crying, trouble feeling motivated for daily activities, feeling lost or helpless, sleeping too much or too little, as well as lack of energy and problems with concentration. While these feelings and emotions are quite common for women experiencing breast cancer, it is important to understand that if you are experiencing persistent sadness, losing interest in these daily activities, or difficulty functioning, these may be signs that additional support could be helpful. Body image refers to how you think and feel about your body, as well as how you see yourself. Bodies often change throughout treatment. You may experience hair loss, scars, surgical changes, swelling, fatigue, and even changes in strength can all affect how you see yourself. These feelings are valid, and acknowledging them is the first step towards healing. As you see here, we have an opportunity to reflect on these changes in identity and body image. First, list 3 things that your body allows you to do that are meaningful to you, and what qualities make you who you are outside of your physical appearance. So if you have printed out this workbook or if you have it online, you can take a moment to pause this video and practice this self-reflection. We have 2 additional reflection pages. I want you to first reflect on the impact of daily life. All of these emotional experiences can impact your everyday activities. Simple routines like getting dressed, cooking dinner, exercising, spending time with family, or returning to hobbies may suddenly become much more difficult. I first just want you to think about some activities that you have not been able to engage in recently that you would potentially like to return to. Give you a moment to pause and then get back into our video. Lastly, this reflection activity is for your support system. Understanding who you can turn to for support at home, having a friend to talk to, or recognizing those who stand by you is crucial during this phase of life. Take a few minutes to brainstorm some individuals in your life who may fit this role. They could include friends, family members, church members, support groups, and more. In our next video, we'll begin discussing practical strategies that can help manage stress, anxiety, and emotional challenges. Please see our next video for Module 2.